we're very proud of the results that we've posted in the second quarter and the first half year. Clearly, of course, a challenging time, a unique time for our business as for all other businesses. But I think we've shown that our business model is very robust. We're a very diversified global business. And clearly, we've played a crucial role in contributing to the fight against the pandemic. It has impacted our business in many different ways, but we've been able to show that by leveraging that diversity with the hard work and dedication of our employees, we've been able to rise to the challenge and play a very significant role in what the healthcare sector has been able to achieve in the second quarter. And that enabled us to deliver, despite the challenges of the crisis, revenue growth in the second quarter and a modest decline in our net income. For the second half year, clearly on the basis of our assumptions around how the pandemic may develop, which of course is a significant uncertainty and risk, we are expecting a significant acceleration, particularly in our earnings. We're very pleased to see that elective patients are returning to hospitals and are able to return to hospitals. I think that's very important in terms of the recovery of the health of society as a whole. And that clearly also supports our expectations to see an acceleration of growth, particularly in earnings growth as we go into the second half of the year.
And looking at your full year 2020 guidance now, would you say that you're being conservative in your assumptions? I mean, I see here the new guidance assumes only regional or local COVID-19 outbreaks rather than any massive wide-scale national shutdowns that we saw the first time around. So would you say you're being conservative or you're actually being optimistic here? How would you categorize it?
I mean, clearly, I think it's very difficult for anybody to say exactly how the pandemic is going to develop in the second half year. As you can imagine, we've done our diligence internally, looking at the potential different scenarios that we could see, what we've learned in terms of how the pandemic affects our business model across our different geographies and across the different parts of our business, whether that's in our hospitals, our clinics, or in our pharmaceuticals area. And we've taken what we believe is a realistic scenario or set of scenarios. And that has led us to be able to guide to revenue growth for the year of 3 to 6%, and an earnings that we think may decline slightly or even post a slight growth. And I think, as I said before, in the context of this unprecedented situation where we've seen challenges in terms of supply chain, very significant challenges for our hospitals and our medical workers, I think that is a very pleasing set of targets, and one that we do think is realistic, but again, one that for us really shows how robust and how resilient our business model is, and how well our business has risen to the challenges that we've undoubtedly faced and will continue to face in the coming months.
To your point about the supply chain challenges, where do you stand now, your hospital groups, in terms of supply and preparedness for a second wave or resurgence in cases?
I would say that we feel very well prepared. With our hospitals under the Helios brand in Germany and the Quirón Salud brand in Spain, we are the largest private hospital operators in those markets, and with that, the largest hospital operator in Europe. We've done a lot of work in terms of securing the supply chain of all of the obvious essential things that we need. And that's not just PPE, but all of the relevant equipment and medicines that are required for treating COVID patients. Of course, we can leverage our scale, and clearly within the group, we also, with our Kabi business segment, have a significant manufacturer of both COVID relevant drugs and wider pharmaceutical products. So we've also been able to leverage the scale of Fresenius to be able to be sure that we're in a good position to be able to provide the best care for our patients. And we've also been focusing on helping to build confidence for patients so that they can feel really safe to return to hospitals for those elective procedures, which clearly as time passes become less elective and more urgent. And we really want to reassure patients that it is safe to come back to hospitals, and a good time for them to have those treatments that they have maybe been putting off but are now becoming urgent. So I would say that we feel very comfortable that we are well prepared. We've shown, I think, very good flexibility across our footprint over the last few weeks and months. Clearly, it's been a learning process for everyone, but we have significant capacities of ICU beds still available in both Germany and Spain. And with the incremental capacities that we've built with the support of the government, and to be sure that we can react as quickly as possible, those incremental capacities, I think, also stand us in very good stead were there to be heightened, let's say, second waves or second outbreaks as we go through the coming months.